Limpopo Health Department says that there is no confirmation that a patient who's been put in isolation at the Ellisras Hospital in Limpopo with a high fever and flu-like symptoms have contracted the coronavirus. The man works at the Groblersburg border post between Botswana and South Africa. Botswana has confirmed 5 suspected cases of coronavirus. We're now joined on the line by Professor Cheryl Cohen from the National Institute for Communicable Diseases. Prof Cohen, thanks very much indeed for joining us. A lot of rumours and speculation is floating around. What can you tell us about the state of fact in terms of testing and the results of testing?
Yeah, so I think the important thing to note is that there have been no confirmed cases of coronavirus in South Africa. I think there are a lot of rumors going around, in different provinces about cases, but really there's been no confirmed cases. As you mentioned, our laboratory at the National Institute for Communicable Diseases is providing testing for any suspected cases, and we've received a large number of samples, but they've all tested negative to date.
All right, so these samples that you're testing coming from various countries on the continent, how many countries have sent samples to you?
So our laboratory is acting as a referral laboratory for the African continent. There's another referral laboratory in Senegal. And so we receive samples from a number of countries and test them. Information on which countries we've received samples from and in fact the results of that testing is confidential. And so, questions about those other countries really are best referred to the relevant countries.
All right, so you continue to test, and at this stage, you're confident that the virus hasn't reached South Africa yet?
Well, certainly we have very, very active systems in place. I think certainly with all of the media interest, there's a very high level of awareness, throughout the country, both in the general public and amongst healthcare providers of this infection. And we've got really clear guidance out in terms of who needs to be tested and really good systems in place to rapidly test. So we're really looking, very, very hard for the virus, and we have no cases reported. There are no cases in South Africa.
All right. So in this incubation period, is it possible to get a false negative?
Yeah, absolutely. I think that's very important to understand about the test. This test is really validated to diagnose the virus or the infection in people who are ill. There is no screening test for healthy people, and we're not testing asymptomatic people. This test is really for people who are ill to identify if they are infected with the virus.
All right. So again, and I think we can't emphasize this or not talk about it enough, but what are symptoms that people should, as soon as they start to feel, go and see a health practitioner?
So I think the important thing to note is that this virus is not circulating widely in South Africa. So the people who have not traveled, who are in South Africa, do not need to be concerned about having this infection. The signs and symptoms are really similar to those of colds and flu. It's fever, cough, and shortness of breath. But the people who should consider that they might have the infection are really people who've been in a place where the virus is widely circulating, which is the Wuhan area of China, and also possibly if they've been in other parts of China. Those are people who should consider the infection. But certainly, if you, because obviously those are very common signs and symptoms. If you haven't traveled to China, if you've got signs and symptoms of colds and flu, my kids right now have colds and flu. It's normal colds and flu. It's not that everyone needs to worry about having the virus.
And what about people at transit points like border posts?
So at the border post, there's very active screening now going on for fever and also sort of looking for people who are ill. And so that's really, put in place to be an early warning. Should someone come to the ports who are ill, that we can pick them up early and contain the infection. But it's important for listeners to understand that screening at borders is never going to be 100% effective, because we know people can be incubating the illness and not ill at the time of the ports of entry. So it's really one part of our way of detecting cases early. But we understand people might come through completely healthy, and so then really the next level is if someone should become ill, that they present to healthcare providers, and that the healthcare providers throughout the country know what to do with that patient in terms of containing them or isolating them and ruling out the diagnosis. All
right. If somebody is symptomatic at home, what should the rest of the family do as precautions?
Yeah, if we find people who are potentially suspected cases or confirmed cases, the World Health Organization has released comprehensive guidance in terms of what they call the home management of patients with this virus, and this includes really trying to self-isolate yourself from the family. So make sure you can sleep in a separate room. Frequent hand washing. I think this is a droplet spread illness like other colds and flu. So really the focus is on washing your hands frequently, and really cough and sneeze hygiene, which we should be practicing all the time. So coughing into your elbow, using tissues and disposing of them appropriately, and then avoiding close contact with others. But there's detailed guidance. Should there really be suspected or confirmed cases? But those are the general principles.
All right. Professor Cohen, we're going to have to leave it there. Thanks very much indeed. That's Professor Cheryl Cohen, who's with the National Institute for Communicable Diseases. So nobody has tested positive so far for the coronavirus, certainly in South Africa. Samples coming from other parts of the continent. Where from exactly, we don't know, but at this stage, no need to panic.